He mentioned genes. If that is a trait, then that stays with you. And then we face, as Dr. Modi mentioned, all the environmental factors. I don't want to list it. There's so many. And he mentioned some of these. I may bring it up, because that's what we have to address practically, where we go from there. But these are the two basic things. He mentioned, and that we all must know, that it is basically a chemical imbalance. It's a chemical imbalance. Serotonin, norepinephrine, dopamine. I think you have to accept this. When we talk about mental disorders, when we talk about depression, you think there's a biochemical change in your brain. You don't need to remember the names, but that's easy. There's a biochemical change has taken place. And all the medications that he listed are directed towards that. I think that simple thing we can remember. Biochemical imbalance in our brain, for whatever reason, and all the medications are directed to that. I have a question to you. The South Asians, is there any higher susceptibility to depression based on their personality? That's my question.
So what I can tell you about in our culture, we have a good support system that we don't see in Caucasians, means here in North America. So that's a one way. It's a very strong support for us. So if we are feeling depressed, there are a lot of protective factors out there. But at the same time, we have certain mindset for depression too, that we carry from our culture, from our background. And we are not accepting if we are depressed that we are depressed. You know, most of the time when I was growing up in India, if something is going on, my parents says, you know, you gotta get over it. That's okay. It's not a problem, you know. But we have to understand that if someone is depressed and if someone not able to function, we cannot ignore it. We have to bring that person for treatment. Trends are changing in India now. People are being seen by psychiatrists now because now they understand that it's treatable.
Are we genetically more predisposed to depression? That's my question.
Not according to research, compared to Caucasian males.
I think that was the first question. Basic personality. Are we genetically predisposed to depression? You said
No.
no. So it comes basically to the environmental factor.
There you go. Because when we came from India, we left all our support, everything behind. We came here, we started struggling. We were so busy with our life. We had to feed our kids. We have to move on. We have to be successful. So it's a very stressful environment for us. And that stress makes us more predisposed for depression.
Is mental illness a taboo in the Indian society?
Still there. Yes, I said compared to Caucasian male, means white male, compared to the population what we see here in Indian community, yes, it is still considered a taboo. Still, people still have a stigma about mental illness. They still do not accept that they have a mental illness most of the time.
Because that is what I experience, not as a psychiatrist.
Mm-hmm.
You see people, members of our community, some on dialysis, going through depression, and we say, well, we like to have health, an expert in mental illness, to come and see you. A total denial. They would not accept, which is sad. So that taboo is still there.
Still there, yes.
I'm talking about a person who is on dialysis. Now imagine a person in our community with not on chronic disease, they will not accept it.
That's true. Absolutely true.
Who is at risk? You mentioned some of the things, and I just summarize. Family history is important. And you mentioned chronic diseases. We already talked about. Trust me, anybody who has chronic disease, whatever its nature, depression is part of it. Very high. I don't need to tell you. If you have another mental disorder beside depression, adds to the problem. Hormonal changes you mentioned. Alcohol and drugs, you mentioned some of these. And how much of this problem lasts for in the South Asian community? Alcohol and drug abuse.
So,
Is it a problem in the South Asians?
drugs, I would not say much. Alcohol, yes, it's possible. We here, like in North America, they do drugs which are hardly, we do it, means like cocaine, methamphetamine, opioids. They are very prone to abuse those drugs. And what these drugs do is they bring down these good chemicals that we used to have. So that's the reason we get depressed. But in our Asian community, I would not say those drugs are more, but I would say alcohol is some part of it.
You may remember about 2-3 months ago, we presented statistics here. And as Dr. Modi mentioned, the suicide rate in the younger generation is very high. And I brought the Ontario numbers presented here. And as he mentioned, is accidents is number one. These are preventable deaths. And the second thing that he mentioned was the drugs. So I followed it out, went into the details. I was in a way very pleased that very few South Asians were involved with the drug and alcohol abuse. It's a treatable disease you mentioned. You have to take medications to restore the chemical balance, as you mentioned. And it's very essential that we take it. You mentioned about psychotherapy, you mentioned about medications. Let me ask you, have you seen depression, cases of depression which are curable? Totally curable. They had it, whatever you did is gone forever. Are there any situations?
Well, that's a very good question, and the real issue is nobody's immune, first of all. What that means, it can hit anybody, okay? No matter how strong you are, from outside or inside, it can hit you, anybody, at any time. One day you lost everything, you started having these symptoms. Is it curable? I would say it's very difficult to say because every individual has a different kind of capacity. Yes, it's treatable, we treat the disease, and as long as you take healthy steps, like you do psychotherapy, you do exercise, make changes in your life, yes, you stay strong and that will never come back. There are some cases, even though in spite of doing all these things, still people get depressed again. So it's very difficult to say. Here is the thing, if you don't get treated, then the statistic says within a 1 year you have 50% chances to get depressed again.
I'll give you an anecdotal case. That's not an example, but it happened once. One condition which I saw a patient, not with kidney disease, extremely low thyroid activity, extremely low thyroid hormone, low activity. And you know, it is associated with depression. So once this person got the treatment for thyroid disease, everything was back to normal.
That's a good point, yes. If it's
Everything was back to normal.
so that's something I would like to pinpoint as well. That's the reason when you see a doctor for whatever reason for your depression, they do list of tests on you to make sure is that any condition that's been making you depressed can be treated with that particular medical situation. Thyroid is number one that can make you depressed. But if you treat thyroid, yes, you are cured. If you have a certain other conditions, Parkinson's disease, some other medical condition, if you treat those conditions, yes, your depression will be treated.
Can you use mic, please?
Sure.
Pardon me?
Use mic.
I want him to speak louder, so.
Okay.
Okay. So do you want me to repeat my answer?
Well, some, if you could.
Yes, so the answer is, yes, it's curable if you have underlying medical condition that causes your depression. As I said, thyroid is number one. So when you go to your doctor and if you're feeling low, better ask your doctor to check your thyroid. Better ask your doctor to screen you for depression because there are a list of blood work that can show that if depression is caused by this underlying medical condition, we just treat that one and that's all.
Complementary treatment beside what we discussed. This is my last slide. Then we have question answers. Social interaction. Now, I have received documents about 5 communities in the world. They live 100 years and they are healthy. What makes them unique? That's what I'm going to present to you sometime later. But one thing stands out, and that is social interaction, which is probably one of the most important points in the total picture is your social interaction. A social interaction, whether you meet, I'm not saying pray, come here, this is social interaction. You sit together, eat together, some sensible, and that is what I mean by social interaction. That stands out in all these 5 communities in the world. Social interaction. Yoga has been mentioned, both as for prevention and help in treating. Acupuncture has been mentioned. I will list these, maybe I'll ask your comments.
Sure.
You mentioned about the ECT already, electric shock therapy. Oh, sorry. Comments on social interaction.
Sorry, what was your question?
Social interaction.
Yes, it's very important. Now, in our community, as I said, we have a good social connection, and that's our strength. That's our strength. In a wide population, they are lacking in that particular area. So that's where the group therapies are very effective. Now, what do you mean by group therapies? Number of people, like 8 or 9 people, they've been depressed and they go to a group and they sit among and they talk about their common issues. And what they talk about in that particular setting is, look, I'm not alone, I'm depressed. And they understand, well, there are other people also depressed too. And they talk about how they get rid of their depression. So that's called group therapy. But in our community, social interaction is number one thing, which definitely a good point. And what we are doing is also would be a therapeutic as well.
Yoga?
Yoga, yes. Yoga, what we are trying to do with yogas and all these physical activities is we're trying to find a relaxation in our mind. Imagine if your mind is a very strong organ. But if you have lots of things running in your mind, day and night, over and over again, days, months, years, you get tired, you get fatigued, your mind needs rest. With yoga, we're trying to set up that new system where we try to feel relaxed inside, just to blank our mind for a few minutes and feel good. Because all our stresses we just leave behind. We also try to do some physical activities, as I mentioned earlier. We try to release endorphin, which helps to make us feel more relaxed, more energized, and less depressed. Acupuncture does the same thing. It releases endorphin that helps us to make less anxious and less depressed.
Questions to Dr. Melody, please go ahead.
I have a question about ECT.
Yes.
In the 60s, people who had it, it was extremely traumatic, and now if people are offered it again, I notice they are very resistant to the idea. So I wondered, is there a change in the kind of ECT or the amount nowadays compared to that time?
Yes. So ECT is still very effective treatment till nowadays compared to our medication. And it's one of the safest treatment compared to our medication. But there is a lot of stigma about ECT. In 60s and 70s, what was the problem? They were giving ECT without having proper anesthesia. So what was happened? What we are trying to do in ECT, we give electric convulsive therapy, means we try to put electrodes here, we try to stimulate, and we try to initiate brief moment of seizures, means epilepsy, brief moment. Why we do that? So when we shake the brain inside, what happens? Brain release serotonin, neurochemicals like dopamine, norepinephrine. And why it's effective? Because after that particular brief moment, you have lots of serotonin, lots of neurochemicals right away instantly, and you feel much better instantly. So it's still very effective treatment. Nowadays, we are giving ECT under proper anesthesia. It's a day procedure. It's a just hour, 2 hours, and you're done.
Any questions? Go ahead.
So is there anything called midlife crisis and relation to depression?
So, as I said, we constantly need goal in our life. Every age in our life cycle, we have to have different goals in our life. When we are a child, we try to explore the world. When we become a teenager, we want to make a relationship. When we go to in our 30s, 40s, we want to focus on our career. 50s to 60s or 70s, we want to be productive in our life. 60s to 70s, we want to contribute something good in community, what we are doing right now. And after 70s onward, we try to reflect our life, what we have achieved so far. And we try to make a peace with ourselves. Look, I did wonderful things in my life. I was a part of a community, and that gives you very good satisfaction. So if we are failing in any of these tasks in that particular age group, things happen. So what happens? If you lost the goal in your particular life phase, that's where the midlife crisis happens. You try to look for other interests because you are not satisfied with your life or your goals, what you have achieved so far. So you look for other things.
Yes, your topic is treatable mental illness.
Yes.
What are the mental illnesses which are not treatable?
So far we have very good amount of understanding regarding mental illnesses. We are in a recent last couple of years, medicine has gone to the point where we've been trying to treat every mental illness. But certain mental illnesses which are still very difficult to treat, one of them is schizophrenia. Why is that? Because once your brain acting out in a psychotic manner with having this schizophrenia, it's very difficult to get back to normal. You lost everything. You started hearing voices which you do not understand. And they never leave you. And you cannot rationalize with that. And you get trapped into it. So with medication, we can control symptoms, but it's not curable.
Questions? Please, thank
First and foremost, thank you very much. Excellent presentation. A two-part question. One is, what's the relationship between anxiety and the depression? Is it a cause and effect type of thing, or one is the symptom
Yes.
of the other? And the part two is, are there any connection between social media? I know we mentioned social interactions, but these days, Facebook and Twitter and all that. Is there a connection between participation in social media and depression?
So your first question, anxiety and depression. Anxiety is very common. We all feel anxious. But some people, anxiety is something beyond what we feel. Constantly feeling anxious, constant, day and night. You feel anxious. You started having feeling inside your heart or inside your stomach, sickening feeling. You know? And what's going to happen when you feel this way? What's going to happen eventually? Because when you feel anxious, it's not only anxiety is a problem, but it releases a lot of things in your mind, in your brain, and that's not healthy. So we have seen with anxiety, a lot of people become depressed. People have a panic attacks. Panic attacks means all of a sudden you started feeling anxious, you started losing control, and you feel your heart races, you feel that everything's going to be down, you're going to die due to that, then it goes away. But in between, you constantly worry about that symptoms. So anxiety, sometimes anxiety is very difficult to treat. Some people feel anxious all the time. Some people have anxiety about speaking in front of other people. Some people have anxiety about just generalized anxiety. Some people feel anxious without any reason. Nothing, like even though they have to pay bill for their electricity, they feel anxious. If they have to go to Walmart, they become anxious. How long that's going to last? It's always there. There is nothing that can relieve their stress. They constantly feel anxious. That's not normal. If you feel anxious that way all day, every single life, yes, then eventually you ended up having certain other medical conditions such as hypertension, diabetes, hyperlipidemia, because of this constant anxiety that you've been experiencing. Media, well, people react differently. It depends on how strong your coping skills are. Nowadays, terrorist activities and all these medias, means politicians talking about, if we observe a lot of things from what we are watching, and that also reflect, and that also affect our mental status as well.
I just want to mention, you probably saw the report. It came out last year from the Ontario group, particularly Ottawa area. 13% of the suicide were related to social media. Can you imagine? That high in youngsters. So social media, more we are learning and answering your questions. It's a concern. You have a question on the back, please, go ahead.
I had two questions.
Louder, please.
I had two questions. One is, during your research, sir, have you looked at the relationship between gut health, especially probiotics and such, and depression, autism, whatever? That's first question. Because that's the upcoming research going on that, and they are saying that probiotics have an impact on depression. Second, have you looked at, in a sense, a comment on your look, that yoga helps, 100% yoga helps, and that's experience like Amplify, right, you benefited from that. But have you looked at the impact of breathing exercises more than asanas or something like that? Because breathing is directly affecting the parasympathetic nerve system, whatever.
That's true.
Has particularly been known to calm people.
Correct.
So,
Short answer.
how
Yes.
valid are these two research?
I'm not exactly sure about probiotics and depression, but depression can make people having upset stomach, GI symptoms. Yes, that's true. Second question is regarding breathing. Yes, breathing is a number one thing that helps, because what happens with breathing, we try to get more oxygen and try to regulate our breathing system. That helps with good blood flow in our brain, which helps to make us feel relaxed. Yes, breathing exercise, that can help. Yes, that's true.
I want to answer about the probiotic. It's for everybody. It's for everybody. You know, we have 100 trillion bacteria in our gut. If you don't know it, you should know it. So they are our co-passengers. They are with us all the time. Are they important? We covered this subject of gut bacteria in our seminar many times. It is so important to maintain the gut flora for our overall health. If you disturb the gut flora, bacteria, we are in serious trouble. So coming back to probiotic, that's the principle behind. You take probiotic and try to maintain the gut environments, which is very helpful, and we are going to cover this in more detail in one of our subsequent seminars.
Yeah, that's the reason when we take antibiotics, then our stomach gets upset. Because what antibiotics do, they kill gut bacteria.
Sorry, go ahead, please.
Thank you for an extremely clear presentation, Dr. Modi. With regard to things people can do to manage their mental health, you mentioned numerous interventions. We talked about yoga and gut bacteria and whatnot. But what I'd like to know is, can prayer, that's one thing, and also cannabidiol, not THC, but cannabidiol, or any of these other things, have they been shown clinically to restore the chemical balance? Most of what we're talking about is observational. I feel better, I did this, I feel better. But compared to the baseline blood constituent, have any of these interventions been proven to improve the balance, chemical balance?
So